Welcome to Hope Institute's Child First Care series. In these videos, we will introduce you to some practical ways you can equip children to thrive. Today, we're talking about child-focused care. Providing child-focused care means that every decision you make is made in the best interest of the children in your care. Sometimes best interest can be tricky to determine, and there can be a lot of voices competing for your attention. You need to follow government-mandated rules and regulations. You want to consider what works best for your caregivers. You might be following a very strong vision from your founder, and it's always important to focus on the donors who support your work. You can't ignore any of these influences, but none of them should be your primary focus. If you are part of a home providing care for children who are not able to grow up with their family, you always need to remember to focus first on the children. The children must be your primary focus. Now, this sounds pretty simple and pretty obvious, right? Your center exists to care for children, so caring well for them should be your focus, of course. But putting kids first can be a real challenge when so many of those other voices competing for your attention have so much power. It's easier for those other voices to advocate for themselves and to pull your attention back to what they need. But remember your focus. What do the children need? So, what does it mean to practice child-focused care? Let's talk about 3 guiding principles that can help keep the kids in focus. First, child-focused care is relationship-based. We know that having consistent, responsive relationships has a profound long-term impact on a child's ability to trust and to build healthy relationships, not only in childhood, but also as adolescents and throughout adulthood. It's important for your center to do everything possible to encourage a strong, healthy relationship between children and caregivers while they're at the center, and to support caregivers in learning and practicing trauma-competent caregiving. Second, child-focused care means being genuinely curious about the personal experience and inner life of each child. Each child needs at least one consistent, stable adult who knows what triggers a stress response for them and how that stress response is likely to manifest, as well as the best way to address outbursts and challenging behaviors that result from dysregulation. Because they've each lived through different experiences, this will be different for each child, but for a truly child-focused center, it is essential to ensure that each child is seen and supported. Finally, child-focused care gives children a voice. You can give children a voice in a lot of ways, including naming and sharing emotions, encouraging future planning, sharing power in the home, encouraging them to help other children heal, and including children on center-level advisory committees, just to name a few. And we'll explore each of these concepts with you in future videos, as well as dive a little deeper into each of these 3 principles of child-focused care. Some of the concepts you encounter in these videos will be quick and easy to implement. Others are going to take some thought and may even challenge the way your center is structured. But they're all intended to help you equip the children in your care to thrive. If you liked this video, check out some more of the resources on our site, and be sure to let us know how staying focused on the kids is working for you.